everyone. And thank you for the kind introduction, Ayi. Thank you also, everyone, for joining us again in this webinar for our ADHD aware, in celebration of our ADHD Awareness Week. So I titled my talk, Children's Behaviors, ADHD, and COVID-19. So at the end of this talk, I hope to define behavior and enumerate the factors that affect it, and to enumerate the effects of COVID-19 pandemic on the behaviors of children. We will try to enumerate the effects of COVID-19 on children specifically with ADHD. And we will briefly discuss ADHD, the signs, the symptoms, etiology, epidemiology, and treatment, and to describe the challenges of children with ADHD during the pandemic. So to define behavior, Webster says it is the way in which one acts or conducts oneself. It is a way in which a person acts in response to a particular situation or stimulus. And it is the response of an individual to its environment. In pediatrics, it is the reflection of a child's ability to interpret and respond to the world around him or her. So this is largely contributed by a child's age and developmental level. Thus, a 2-year-old responds very differently to an adverse situation and behaves differently than a 4-year-old. A 2-year-old may throw a tantrum, whereas a 4-year-old might ask why. A 4-year-old, on the other hand, may be acting like a 2-year-old because of his or her development, which is delayed, particularly if he's at a 2-year-old level. So we see several factors affecting behavior. And we know that a child learns most of his or her behavior from his interaction with the outside world. Early on, the child learns most of his behaviors at home. So we see the effect of parenting. No? So we also see the effect of the quality of childcare and early education as the child grows older. And then as he explores the community, the cultural traditions, customs, and beliefs also impacts on his behaviors. Then we also see increasing evidence of behavioral challenges due to exposure to screen-based technologies. Largely, we know that behavior is affected by environmental factors. Earlier, we had a webinar talking about early childhood adversity and toxic stress and its effects on children's behaviors. And we also see the effect of poverty. Also, studies show about behaviors of children placed in foster care. So the following are examples of behaviors observed in infants and young children, which may be considered normal, and it will resolve spontaneously as a child grows older. Behaviors in infants like infant crying or colic, no? Bedtime resistance and night wakings, may mga night terrors, no? Night wakings, breath holding spells can be normal in infants. As the child grows older, a child will develop fears and anxious behaviors. They can also manifest with repetitive behaviors and habits such as nail biting, thumb sucking. No? It is considered normal, and as I've said, it will resolve as the child grows older. It becomes a problem, however, if the behavior persists and interferes with daily functioning and causes distress to the child and distress to the family. Just to inform you, the following are some behavioral problems and disorders among children, which can be a cause of concern. Some we cannot discuss at length at this time. So we see behaviors like feeding and eating disorders, no? Picky eaters, no? Pica. We see reports of sleeping disorders, somnambulism, sleepwalking, no? Elimination problems like enuresis and encopresis. No? And we see common problems that are encountered like autism spectrum disorder and attention deficit hyperactivity disorder, which constitute most of the referrals we see in our clinics as developmental and behavioral pediatricians during this current time. We talk about the environment being a major factor that contributes much to how a child behaves. The global pandemic has affected our society so much in a lot of ways, and we are now on our 7th month since the announcement of lockdown in our country. Well, 9 months if we consider the first case identified. We look at how this has affected the lives of our children. So our children used to have a daily rhythm. They wake up, they prepare for school, they study, they take breaks for playtime and socialization. They play with friends during weekends. They visit relatives and go out as a family to attend Sunday services, to attend church, and then probably some dine out. But these other activities are suddenly disrupted and discontinued because of the pandemic. No? Active children who enjoy playing outdoors are now stuck inside their homes with little to no access to face-to-face interaction with their peers. We also feel its toll on parenting, which can largely affect how we deal with our children. We hear of rising number of cases, people dying, economy falling, and other negative news, which our innocent children may be exposed to if we are not careful. I came across this news clip. Children who recovered from influenza encephalitis following the endemic of 1917 to 1918 often displayed symptoms of restlessness, inattention, impulsivity, easy arousability, and hyperactivity. This was described then as a post-encephalitic behavior disorder. So this is something similar to ADHD that we will describe later. However, in this case, during that pandemic, the children were infected with the virus. No? The following reports and studies briefly describe the effect of this crisis on our children's well-being. We see the impact on behaviors and emotions. A narrative review of several journals and articles on this topic was done, and they summarized the following impacts on a child's emotion and behaviors. In younger children, they observed increased clinginess and feelings of fear. No? They express fears that their family members could get the COVID infection or that they can even die. No? And some children even express concern that they are the cause of the disease in their infected parent. In older children, they observe behaviors like inattention, children persistently asking questions, no? And inappropriate emotional responses, such as lower levels of affect. Throughout all age groups, the following behaviors are described, no? Clinging, being inattentive, increased irritability, feelings of uncertainty, fear, and isolation. We also see children with disrupted sleep, experiencing nightmares, having eating problems, being agitated, and children expressing separation-related anxiety. Among you, may mga anak ba kayong pag pumasok na kayo sa clinic, doesn't like to let you go out of their house. No? So we see this in children. A similar study done in China revealed the same findings in a parent survey. They noted that about 30% of children manifest with the same behavioral concerns, such as being clingy, inattentive, irritability, worrying a lot, obsessive request of updates, fear for the health of their relatives, again, sleeping disorders, eating disorders. They feel so tired, fatigued, kahit wala silang ginagawa. They feel discomfort and agitated. There is growing evidence that it affects the mental health of children, as we have lectured during our mental health awareness campaign. We know that children with the most direct exposure to the pandemic, such as losing a loved one or whose family is struggling with the disease, food shortages, or other deprivations, may be most at risk for psychological disturbances. And children already manifest with problems like anxiety, depression, separation anxiety, and long-term, we may probably look at post-traumatic stress disorder as increasing among our youth. With regards physical behaviors, we see overall reduced physical activity and prolonged sedentary behavior among our children. This study done in China at the beginning of the pandemic and towards the mid part analyzed the effect on physical activity and sedentary behavior. They analyzed data from 2,400 children and adolescents 16 to 17 years of age. So this is their results. No? They found out that the children had a substantial decrease in physical activity and increase in screen time during the COVID-19 pandemic. Diba? Siguro naman kahit sa atin, ganyan din. But you look, overall, the median time spent in physical activity decreased drastically. Before the pandemic, physical activity was 1 hour 20 minutes a day. Now it's 1 hour 45 minutes a week. So that is like 15 minutes a day of physical activity. Ano na lang kaya ang ginagawa nila the rest of the day? Of note, during the pandemic, prevalence of physically inactive students extensively increased from 20% to about 65%. Screen time, so this is what is of a concern also, considerably increased from 1 hour 30 minutes a day to almost 6 hours per day. Screen time during leisure was also prolonged, indicating that nearly a quarter of students engaged in long screen time for leisure. No? And I believe we get to have longer screen times in our country. Malamang more than 6 hours a day. And in our clinic, yung 6 hours a day, pang ano yan, toddlers and babies. So what more for adolescents? And I believe we get to have longer screen time, really. Sadly, this pattern will greatly affect the development of children, especially causing language delays and social impairments. And it will also greatly affect behavior, causing now a surge in autism and ADHD problems. Another study in Canada also showed decreased physical activity and increased sedentary behaviors among their children 5 to 17 years old. This study identified some healthy movement behaviors, however, such as the involvement of the parents to encourage their children in physical activities and having a dog to counter this effect. So we see in Canada, the parents involve themselves with their children's activities, thereby increasing their physical activity. On the other hand, the study pointed out positive effects such as families and children adopting new hobbies and accessing new resources, which I am sure we also have developed. Several other studies, such as this one done in the US, also describes the effect on physical activities of children. They used to describe school-based activities, and now it is replaced with free play or unstructured activity. And now children there spend 90 minutes of school-related sitting, so 1.5 hour lang of school time, and over 8 hours of leisure-related sitting per day. So talk about inactivity, no? Physical activities were done mostly indoors and only within the neighborhood streets. Dati they go to park, they have leagues, no? They have sports activities. And about a third used remote or streaming services for activity classes and lessons. No? So this now study posed an increased risk of obesity, diabetes, and cardiovascular disease in children. There is a broad spectrum of developmental and behavioral disorders, and children have varying reactions and behaviors in response to the pandemic. Some were described to have disturbed behaviors due to their intolerance to the unknown, especially as these children more often than not perform well with predictable outcomes. Alam nila kung anong mangyayari tomorrow and the next day and the next. But because of this crisis, it's quite unpredictable, so they cannot tolerate that. A large number of these children thrive with a good structure or schedule. Thus, the changes in daily activities brought about by the lockdown somehow disrupted their routine, and some were described to have aggravation or worsening of their condition. Some kids depended heavily on others and specific resources like therapies, special educators, to be able to function. But somehow, there was a discontinuation of these services. Others, because of misunderstanding and stress in the home, it triggered outbursts of disruptive behaviors. So just imagine the struggle of taking care of a child with special needs during this crisis, especially the more severely affected children. Now, we go to its impact on a child with ADHD. What if a child is extremely energetic? He cannot stay in one place for a long time. He cannot finish a task. He needs to be on the go. He cannot keep quiet. He needs to do several things at a time. No? And then he is all of a sudden asked to stay put, stay home, to be quiet, no? Practically to just not allowed to go out. These children with ADHD were observed to have increased hyperactivity and heightened impulsivity and escalating inattention symptoms. So their impairments became more severe. So these children are asked to stay glued to their gadgets, not discounting the potential danger it poses to them. Now, let's have a brief review of what ADHD is all about. Attention deficit hyperactivity disorder, as was mentioned by Dr. Balanag earlier, is the most common neurobehavioral disorder of childhood. And it is among the most prevalent chronic health condition affecting school-aged children. So it's a chronic condition. Children with ADHD are characterized by hyperactivity, impulsivity, and inattention. However, these symptoms must be developmentally inappropriate, no? And they should cause significant functional impairments, such as academic underachievement, no? Problems with interpersonal relationships with family and peers, and can cause significant lower self-esteem. So as pediatricians or other primary care clinicians, we should initiate an evaluation for ADHD for any child or adolescent aged 4 years to 18 years who presents with academic or behavioral problems and symptoms of inattention, hyperactivity, or impulsivity. To make a diagnosis of ADHD, the clinician should determine that DSM-5 criteria have been met, including documentation of symptoms and impairment in more than one major setting, with information obtained primarily from reports from parents or guardians, teachers, other school personnel, and mental health clinicians who are involved in the child or adolescent's care. So the following are symptoms which we look at. No? We look at inattention problems, or the child has difficulty paying attention. The child has a hard time paying attention. He does not seem to listen. He is easily distracted. He makes careless mistakes in schoolwork. No? He does not follow through on instructions, or he cannot finish tasks. He is disorganized. No? The child often forgets things. He frequently loses his things. He frequently avoids doing things that require sustained mental effort. So these are inattention problems. This slide shows us hyperactivity problems. A child is being overactive. No? A child manifests with hyperactivity when he is fidgety and squirming while seated. Sabi nila parang may bulati sa puwet. He keeps on standing up and staying even when staying seated is expected. No? The child can feel restless. In older kids, they may not manifest with the usual hyperactivity. However, you see them feeling restless. No? Children are unable to play or engage in hobbies quietly. They often are described to be on the go, or parang nakwerdasan ng motor, sabi nila, driven by a motor, no? And they talk non-stop, no? Ang daldal nila, no? The following are impulsive behaviors in children with ADHD, or acting without thinking, no? They frequently act and speak without thinking, no? They frequently have trouble taking turns. So hirap silang mag-wait. They cannot wait for their turn. They cannot wait for things. They frequently interrupt others. No? They often call out answers before the question is complete. So these are the following symptoms which you will fulfill when looking at the DSM-5 checklist. No? So what is the prevalence of ADHD? Reports of worldwide prevalence says it affects 7.2% of children. No? However, community-based estimates are higher. It affects around 8.7 to 15.5% of children. So medyo madami. So if you have 10 10 kids, may ADHD in a classroom. No? Median age of diagnosis was 7 years old, and approximately one third was diagnosed before the age of 6. No? And about half was diagnosed by a primary care clinician. They also say that boys are more than twice as likely as girls to be diagnosed, no? Possibly because hyperactive behaviors, which are easily observable and potentially disruptive, are seen more frequently in boys. No? In ADHD, comorbidities are very common. No? The majority of both boys and girls with ADHD also meet a diagnostic criteria for another mental disorder. Boys are more likely to exhibit externalizing conditions like oppositional defiant disorder or conduct disorder, no, mga pasaway. Recent research has established that girls with ADHD are more likely than boys to have a comorbid internalizing condition like anxiety or depression. And a majority of children will manifest with language and learning difficulties. No? So sometimes they may manifest as difficulties coping in school, so that they will come to you in your clinic na having problems coping academically. And then you notice that, okay, there is an associated ADHD. As was mentioned also earlier, the course of ADHD is prolonged. It is a chronic condition of childhood and adolescence, and it can persist into adulthood. I don't know if you can see it clearly in your slides, but as the child grows older, symptoms will change also. Like in adolescence, you see them not fulfilling their academic potential. They have reduced tolerance by their peers. They have low self-esteem. No? They have smoking, alcohol, and drug experimentation already, no? And they develop antisocial behaviors. Among our college students, if they persist to have ADHD symptoms, they will have academic failures, they have difficulty coping with routine tasks, they have occupational difficulties, no? They also have low self-esteem. Sometimes they are the ones who are misusing alcohol and substance use, no? And there's a high incidence of injuries or unintentional incidents because of risky behaviors. Among adults, they can manifest with mood instability, apart from the low self-esteem. They have relationship problems. No? Mapapansin mo, they break up with a girlfriend and they transfer with another relationship, and very short-lived ang relationships nila. They have increased road and occupational incidents. Na? They have difficulty planning and completing tasks. More often than not, sila yung palipat-lipat din ng trabaho. No? They also report alcohol and substance misuse, and when they are parents, they manifest with inconsistent parenting styles. What causes ADHD? They say again, the interaction between genes and environment. So nandiyan na naman yung epigenetics natin. Also, the following environmental risks are posed to be possible contributory factors like cigarette smoking, alcohol use, or drug use during pregnancy. And then the exposure to environmental toxins. And then children with low birth weight and with brain injuries are also at higher risk for developing ADHD. Again, we see the interplay of environment and genes. No? What are the abnormalities in the brain? We see structural and functional impairments in the brain. They describe lower gray matter densities, white matter abnormalities. There's a reduced total brain volume, and volume of some brain structures are affected. There are cortical differences. No? And there are impairments in the prefrontal striatal networks, primary impairments in the frontal limbic networks, and under or over activation of some brain networks. So generally, the brain is again affected. We also give importance to neurotransmitter alterations. No? So we see delayed maturation of certain dopaminergic neural pathways, and there are lower levels of available dopamine receptors and transporter molecules. So this will be the basis now of why medications are given to children with ADHD. No? In line with that, there is no cure for ADHD. Currently, available treatments may reduce the symptoms and improve functioning. Available treatments include the following, which will be discussed in our next talk. Now, what happens again to a child with ADHD in a crisis? Okay, so actually, there are two phases, or there are two extremes that a patient with ADHD can manifest. On the right side, a patient with ADHD tends to hyper-focus, or ibig sabihin, di na siya ma-disturb. He can finish a task when he is very serious on it. And we also see children who develops creativity. Naging creative sila. Sila yung nag-initiate, na gumawa ng campaign, no? For frontline health workers, something like that. And we see that these children with ADHD are more resilient than the general population of children. We also see that they are more compassionate. No? So these individuals are more reaching out now to the people who are affected, no? Compared to other people, in the general, yung mga walang ADHD, they tend to really stay home only. And this ADHD children or adolescents, because hindi sila mapakali, they go out and reach out and show their compassion to others. However, on the other end of the spectrum, some children with ADHD are usually distracted, no? And they usually go off task. Hindi sila makatapos ng mga ginagawa nila. They are very impatient and they are restless. No? Some of them already develop anxiety, no? Especially nga naman, di sila makalabas, they can't go out, they can't do what they usually do. No? And then they have, some younger kids have so many things to do and so much to remember that they cannot keep up. No? They have to remember to wash their hands for 20 seconds. They have to remember to wear their mask. They have to remember to put on a face shield. And sometimes they tend to forget. No? In younger children, they also manifest with impulsivity and rebellious behavior, especially when rules are already put in place. No? So this is the crisis now that our children are facing, that our children with ADHD are facing. Several reports have manifested this one, have shown this one. No? This report, this parent survey was done among 241 parents of children 6 to 15 years old. No? They reported that children's ADHD behaviors during COVID-19 outbreak significantly worsened compared to their normal state. No? And they said that the children's negative mood state was associated with the ADHD symptoms. No? As well, parents' mood state also impacted the children's ADHD symptoms. So parang vicious cycle na naman. So, syempre, a child who is very energetic and loses control, thereby, the parent also loses his temper. No? It affects the mood of the child. No? However, this study saw that if a child with ADHD has longer study time, the ADHD symptoms are reduced. No? So the importance of a structure is really seen here. Another study showed here that the ADHD child struggles with a break in routine. No? Because children with ADHD typically thrive with routine and predictable structure, which allows them to understand and be aware of their daily expectations in a consistent manner. However, because of the break in routine, these children now manifest with increased irritability. They now manifest with oppositional behaviors, and challenging behaviors, other challenging behaviors, temper tantrums, no, aggression, no? And likewise, children are reportedly having lack of activity. Di ba nga, like kanina, the physical activity is lessened. No? They have a break in their individualized learning. No? They cannot focus anymore with schoolwork. No? Plus, the environment is full of distractions. Sabi nila, no, news, no, with the people. You seem to be staying at home on own most of the time, but you tend to be very busy. No? And this shouldn't also manifest with difficulty in transitions, no? And some manifest with deteriorating sleep patterns. We see here also a report of children with ADHD having an increased risk for COVID-19. No? This is a study done in Israel, no, among 30,000 reports of patients who tested positive for COVID-19. They saw that the COVID-19 positive subjects were younger, they were more likely to be males, and they belonged to a lower socioeconomic status, and that the likelihood of COVID-19 infection was positively associated with having a diagnosis of ADHD. So what does this mean? It means that the child who has ADHD has a higher risk for developing COVID-19 infection. Kasi nga naman, di ba, he wants to go out, hindi siya mapakali, lalabas siya ng bahay niya. And then paglabas niya, he forgets to put on his masks. No? He forgets to keep social distancing. No? So these are the risks for a child with ADHD to develop COVID-19. We talked about comorbidities earlier. Now we see also the worsening of comorbidities in children with ADHD during these times. Among children with ADHD and depression, they see worsening mood or irritability while being away from peers or normal activities they usually enjoy. No? Among children with anxiety, they are now more worried. They are now more anxious. They have panic attacks. No? They express significant distress over the pandemic. No? So mas ano sila, mas napapaning. Di ba nga sa news we see a lot of children already committing suicide, no? Increasing incidence of depression and anxiety. So we will see. Maybe some of you will have a study on that. Sino kaya sa kanila ang may history of ADHD? Malamang there's a high percentage of children with ADHD among these adolescents reported to go to have suicidal ideations. No? With regards to oppositional defiant disorder, we see children argue more with parents, argue more with their teachers, argue more with their caregivers, siblings, and others. And these children also refuse to listen to or go against the wishes of adults who are in charge. So they refuse to follow rules about physical distancing, hand washing, and wearing of masks. So we see the difficulty of children with ADHD during these pandemic times. Okay, so as a campaign for this ADHD Awareness Month, and specifically for this ADHD Awareness Week, we know now that this current pandemic negatively affects our children's behaviors, more so with the children with developmental and behavioral needs. No? COVID-19 can both positively and negatively affect children with ADHD. And we now know that ADHD is the most common neurobehavioral disorder in children and can be diagnosed in the clinic setting, in the pediatric clinic setting, and by any primary healthcare clinician. It is characterized by hyperactivity, impulsivity, and inattention. And this behavior should be developmentally inappropriate and causes functional impairments in academics, occupational functioning, and in social relationships. Okay, at the end of the day, I hope this talk will encourage and remind all of us of our role as stewards for the children, not only with ADHD, but all children entrusted under our care. With that, I would like to thank you for your attention. Thank you for listening, and God bless you and stay safe.